Good afternoon. Today is September 16th, 2022, Friday. This is United Medical ACO. My name is Kemal Erkan. I'm here with Sean Donegan. Sean, how are you doing?
I'm doing great. It's good to be back.
Good to be back after a couple of weeks of the break. So we have new updates, some of the same topics with new updates, some of the new items. We do have a revenue cycle management update from our RCM team. Alp Shantai will be with us. And also we are going to discuss the US economy and the global events and some of the upcoming events in the next 50 minutes. So we are going to start with our COVID update as the flu season is coming. This is actually going to be important what we do from now to the next couple of months.
Yep.
So what's happening on the COVID world?
So as we know, we had a couple of weeks off. So these numbers that we're seeing here are going to be a little bit significant compared to the numbers we had 3 weeks ago. So the impact that we're seeing overall with cases and our mortality rate, death toll that we have is actually decreasing overall. So the trend is declining steadily. It's not a super drop-off, a super rapid drop-off like we've seen with some of the exponential changes in previous times when the seasons are starting to change. But overall, we are plateauing and starting now decrease, which is a good sign overall. As you mentioned, we are now going to start approaching the fall with flu season. People will be getting sick just because the weather changing. So it is important to remind everyone that they have the at-home test kits that you're going to want to test there. That way you can identify if it is in fact a regular cold, maybe the flu, or if it is COVID, one of the new variants, you can treat it more seriously.
Absolutely. So did you get your COVID kit?
I don't have mine yet. I'm planning when I'm back in New York. So see my family and get them all set up, squared away.
So I think I have like 3 of them at home. They're handy because when you feel like there's something happening, the best is if you have it available and then you get tested, and then at least it actually gives you some freedom in terms of what you are able to do. We do ask our patients and everyone else to make those available. Hopefully everyone would do that.
Yep.
And
so we also had the monkeypox update here.
Did they change the name yet?
I don't know. I know that there was the whole push for it, that they wanted to rename it. People were offended. So I'm not sure if they decided on something or if it's just the new monkeypox.
So my kids are offended by this? They're up in arms?
They are, I don't know. I'm personally not. So I will refer to it as monkeypox until we can agree on a single name. That's not for me to decide on. So I don't know who makes that decision, but
definitely not us.
Whenever they do, they can let us know, and then we'll refer to it as that. But in the meantime, stay on the same page. I'll call it the monkeypox cases. Again, it has been 3 weeks since our last reporting. And in that time, it looked like around August, maybe like 10th or so, the middle of August, it kind of peaked at over 400 cases per day. And then since then, it has steadily declined. And then the most recent update from the CDC was September 14th, and that was actually down below 200 cases a day. So it almost halved in that 2-week span right there, or the month span, I should say. So good signs in regards to the monkeypox and how that is spreading. And then just number-wise, to keep everyone up to date, in the US, we're almost at 23,000 total confirmed cases. Of those, around 35 were in Delaware. But again, with this with the monkeypox, the mortality and death rate is not as severe. There have been some deaths, but it looked like it was in Africa and South America where they were being reported. Here in the US, I don't think anyone has died as a result yet.
Well, let's keep people alive. So now, speaking of the flu season, United Medical Clinic, they have their, I'm going to actually see exact dates, the drive-through flu shot, which we do every year. Hazel Dimat, one of our directors from United Medical, is able to orchestrate this for the last several years. So I'm going to give you guys a date. UMC Flu Drive. Bexwood's location, September 21st and October 5th. And similar location is September 27th and October 12th. In the past years, we did have several patients without them getting out of their car. They were able to come in and get their flu shot. The best way to prepare for this winter is the flu shot. So that's kind of like, I mean, I'm not going to argue with people if they don't want to do it, that's fine. I'm just saying that if you are following certain medical guidelines, getting your flu shot is, it doesn't prevent the flu, but it does make certain things less severe. So therefore, I think everyone should follow that. Hopefully more people this year, we kind of learn our lesson. Wearing mask if you are over, especially if you are over 65 in public places, protecting yourself with the mask is going to be important. For monkeypox, I think it's a little bit more difficult to get the infection. So if you have active sex life and then you are not doing that with your partner, and if you are sleeping around, then you are going to most likely higher chance of getting it.
So don't sleep around, everyone.
Don't sleep around. So, but that's about it, right? So the flu, the drive-through flu shot is important. United Medical Clinic is able to provide this for almost 1,000 patients every year. I don't know how many patients sign up so far, but hopefully we can get more people. All right, so today, first time, we are going to have one of our new client managers joining us from the RCM team. I'm going to let him in.
Oh, can you guys hear me?
We can hear you, but a little bit louder, maybe the Zoom setting or the, see if
Is it better now?
Yeah,
Yes.
I think if it's picking up the microphone from the headphone, you may have to have the microphone closer to you. If not, on the microphone setting, you can choose webcam and it should pick it up from your laptop.
Okay. Is this any better right now?
Yeah, it is better.
Kind of holding it close. Okay, perfect.
All right. Well, Alp, so this is your first time with us. Thank you for joining us. So revenue cycle management updates, as we made this part of our rotation every other week, it's actually, it becomes even more important when we do these updates. Now, going back to why we are doing the updates from the RCM side as well as we do the clinical, our audience is mainly our patients, but then our employees, our providers, our network, and the public. So I was in our Turkey office in the last 2 weeks, had several meetings, and it was actually pretty rewarding to hear that some of our employees are using our RCM videos as part of their training. And then in some cases, they do go back and then they rewatch what we discussed. So that's actually, that gives us a little bit more responsibility now. So meaning that now we have to do maybe a little bit slower, a little bit, I was not doing PowerPoints much since they may be watching them for training purpose. So we may slow down a little bit. So today we are going to discuss timely charge entry and impact on RCM. And you are someone who works very closely with me and with our clients. And with this topic, you actually did help our United Medical Clinic operations. And we wanted to kind of have you give this update so that way we can help our providers as well as our employees. So I'm going to start presenting from the PowerPoint so you can actually, I can give you access to the PowerPoint so that it can be on your page. Let me try that, okay? Right. So I think you need to be at least a co-host. Let's see which URL co-host now. So this doesn't actually, why am I not able to give you that access? Let's see.
It's not that big of a deal for me. I mean, you can do it as well. That's totally fine with me.
All right, let me try one other thing. At my home computer, it was working. All right, so I guess I will, right now, we are going to share the screen. Okay, you are able to see it, right?
Yes, I can.
Okay.
All right, should I go ahead?
Yep.
Okay, awesome. Well, first and foremost, thank you so much for having me here this week. I will be talking about the timely charge entry and its impact on the revenue cycle management. My name is Alpsente. I've been in the United Medical family for the past almost 2 years. I'm a client manager. So medical billing may seem like a simple process to an outsider that like we submit the claims, but it gets paid. But unfortunately, it's really not that simple. There are many steps that are involved within the revenue cycle management process. And posting the charges in a timely manner is an extremely important step for providers, as it can lead to like unexpected bills or even delayed care for some of the patients. And it is also critical for the reputation, relationships, and even compliance for the providers. So that's why we put a really good focus within the last few months on timely charge entry, especially for Kemal's practice, United Medical Clinic. And that also leads to efficient, stable, and timely payments. And it's really good for the revenue cycle of the practice. So days in AR is one of the many reasons why timely charge entry is important. So for those of you that don't know, days in AR is how long it takes for your claim to go through the average accounts receivable process. And if you look at the formula on the screen, it's your total charges posted within the last 120 days. This is the amount of days that we use to calculate our formula, and divided by the 120, which is the days, which gives you the average daily charges for your practice. And then once you have that number, you calculate your total accounts receivable within that same date frame, so 120 days. And then in this case, we put down our average daily charges as around $3,000. These are just examples, made up numbers. And then our total accounts receivable was $115,000. And then that divided by the average daily charges is 38.33, which is our days in AR. It's not bad. It is under the benchmark for MGMA because their standard is 40 days or below to be better. It's not bad, but there's definitely some room for improvement there with that 38.33 days number. Can go into the next slide. Again, it's how long it takes for your claims to go through the average accounts receivable process. So I know some people are better with seeing the numbers and formulas, so I explained it in 2 different slides. Again, you can use this for 30, 60, 90, or 120 days, whatever you're calculating. But as United Medical, we use the 120 days benchmark for this. We can go to the next slide. So also, as I mentioned in the beginning, RCM process is really not that simple. And quite often we face different problems related to the claims, which requires us to resubmit them for several different reasons. That is why it's absolutely crucial to enter the charges in a timely manner from the provider's side. This slide, I'm showing you the timely filing limits for some of the insurance companies. Of course, each insurance company from different states, they have their own timely filing limits, and it's really hard to follow these usually. But we can see here that, for example, Medicare and Highmark, their timely filing deadline is 365 days from the date of service for you to make a correction on your claim or submit the claim. But we can also see that for United Healthcare and Medicaid, it's only 90 days. So if these charges are not entered in a timely manner, it's hard to keep in track with these, because if you enter your charges like 30, 45 days later, then you only have 60 or 45 days left to make those corrections and get payment for your charges.
So the only thing is, I think, Highmark, while we're actually continuing, if best or one of them can double check. I thought it was 6 months for the initial one, but I may be wrong. If they
I got it from Google. That's what I found, but I can double check on that as well.
Finishing the training last week, so in Turkey, so I have some of these fresh. So I think it's 6 months, but best they can text me once she double check that.
Okay, yeah, you may be right on that.
So when this timely filing, when something is not filed, main thing is what's happening, like other than affecting our numbers, it's actually we don't get paid, right?
Yeah, exactly.
So,
they don't pay us. They say you've expired the timely filing limit, and that's it. We don't get payment for it, and we have no way of taking it back if we don't do these things in a timely manner.
All right. So this is your next one.
Yep. So number 3 is the financial complications of the timely charge entry. Again, it's decreased revenues, as I just talked about, within the timely filing limits. As Kemal said, if we don't do these in a timely manner, we don't get paid. So our revenues decrease. And then this also delays the revenues. This is important for the practice's revenue cycle management. If you don't have enough cash flow because you're not entering your charges, it might put the practice in a bad situation. And we also have charges to payment ratios, which I'm going to be talking about in the, I think it's the slide after or the one after that. So another thing that we wanted to touch on today was from the UMACO standpoint and the risk score implications. So these late charge entries, they also impact the risk scores for the United Medical ACO clients. If, let's say for this year, if you don't post your charges until a certain date, certain time of the year, they won't affect the risk scores for this year. And therefore, you're not going to see those changes with risk scores at the end of the year. And therefore, your shared savings might decrease based on this, and it affects the value-based contracts. I don't know if you want to touch more on this, Kemal.
So, yeah, we'll come back to this once we have your full PowerPoint.
Yeah. So next we have the charges and payments. As I said, this is for one of our clients as an example, whom I worked on a project similar to the timely charge entries as well. So from what I learned from Kemal, for an average PCP practice, this charges to payment ratio should be at around 50%. And for this client, you can see that.
So that's our internal setup, so that way we can use that as a benchmark, right?
Yes, correct. For an average PCP practice, right?
Correct. Yep.
Yeah. And we would want to see that at 50%. And if you see here for January and February, this number is at 40% and then at 32%. This is due to some of the late charge entries, providers missing their charges. So then when we started doing these projects, you can see the charges to payment ratio is inflated the months after, because you're getting more payments and all that stuff. So
like when we enter like 748,000 one month, next month we go up almost 33%. And then we go down again and we go up again. And what happens with this inconsistency, the formulas that we are utilizing, the days in AR and others, they don't actually provide any help. The tools that's supposed to be helping us, when we don't do our charges in a timely manner, we are also making our practice handicapped because we cannot utilize the standard tools in a good way.
So, yeah, absolutely. And of course, the cash flow for the practice as well. If these are delayed 1 month, and then the next month you're not going to be getting paid as much, and then the month after you're going to be getting paid a lot more. So all these things with late charge entries, they affect them. And then next we have the report card, again for the same client. You can see in the days in IR 120 column, that it slightly goes up above 40, which we don't want that for our clients. And then it starts decreasing after that because the charges are entered on a timely manner. So they stay less days in the accounts receivable process and they get paid faster.
So like this report actually is a little bit clear, more clear than the other one. So because when I have the charge at 748, when we have the formula is average of 6 months charges, right? So this 748 is on the lower side. So when my days in AR is at 31 days, then when I catch up with the charges, which again shouldn't happen, when my charges go up to 1.1 million, all of a sudden it looks like my days in AR is 43 days, which actually is not the case. It is 43 because we didn't enter the charges correctly. Normally, it would be alerting situation when you go from 31 to 43. So that's why I'm saying that this is a tool. That tool needs to be utilized. So in order for the tool to be utilized, you need to be consistent. You need to go with the system. So is this is there something happened between the 31 to 43 days? Something happened in my practice, or is it just because I didn't enter the charges? So because next month we go down to 26 because we have less charges, because this less charges reduces the total charges for that 6 months period, right? So then all of a sudden, something that we use, again, the main key learning for us and for the clients as well is tools are not being utilized, cannot be like we make ourselves handicapped with these inconsistencies.
Yeah, absolutely. And also, while you were explaining that, I just got the email from Besta explaining the timely filing limits. So for Highmark, the timely filing limit is actually 12 months, but the correct claim limit is 180 days. So that's probably what you remembered. But again, yeah, for UHC, it's only 9 days we have for the timely filing limit, which if the charges are not entered within the next like 90 days, we can't get a payment for it. And then next, this is both for the providers, I guess, and the accounts receivable, the billing department, where as Kemal always says, it's about checks and balances. So you can check these timely charge entries either through PowerChart or SPM. So for the SPM part, when you enter SPM, you just go on the top left corner and you click on the patient monitor, and then you select your range for the date of service, whatever you're auditing. I usually try to do like 2 weeks prior, and then I select the offices and the providers that you want to audit for the late charge entries. And then finally, when you hit retrieve, you can go to the next slide. This is the result that we get. So this was for the week of 8/22, so 2 weeks ago. We still have 4 charges outstanding. I don't know what's going on with that, but we might need to check on these. But still, 4 is not that big because when we first started doing these projects, there was like hundreds of them still missing. And then next, we can also see the same thing on PowerChart. This is important for the providers mostly, because this is where they actually enter their charges and their notes, the medical records and everything. So if you go to open items in the top right corner in PowerChart, and then you select the settings in the drop-down menu and check mark charge to display those. If you can go
so this is directly from our PowerChart, our EMR system. So just to kind of make it a little bit clear. So this is on SPM. So our office administrative staff would be following the charges through this, but then charge entry comes from PowerChart because our providers are entering them. So that this is how providers are able to keep track of those, not only the charges, but their notes, their task and outside records altogether.
Yeah. So it's all about checks and balances, as you always say. And then this is the result that you get from PowerChart for the providers. And if you view the outstanding actions column that's highlighted in red, you can see that the charts are not posted or what's going on with it. So this is how you can follow through Power Chart. That's it for me. Thank you.
All right, so I'm going to stop sharing here. So what you shared with us actually is the essential for any practices in the United States. So I do want to give you just some recent, something happened just recently. So I'm in the new place for the last 3 years. I call new place, but it's no longer new. So waste management is our trash people. So they have our credit cards every Monday. So for those from our Turkey office, if they don't follow what I'm saying, we do take our trash out, like personally, like someone from my household would take it out, and then we would put it on the street in a dumpster, and then the trash waste management is the one that I use. They would come and take them, pick them up weekly. Well, this week they didn't. So, well, actually, I'm gonna have Sean back in. So, okay. Because he's here, so I thought he was already on. So the they didn't actually take my trash this week. So I thought maybe it was a holiday or something, because Labor Day and Memorial Weekend, so they don't take those times. So we waited for next day, and then they didn't pick up. When we called, they said the credit card on file expired 12 days ago, and they stopped
the service,
providing the service. Now, what we don't really understand in our healthcare business, and in some cases our patients, some cases our employees, so we don't get actually paid at the time of service. So we may never get paid, or if we get paid, insurance may come back and take the money back. All these things are our day-to-day life. In fact, I won't name the insurance company, but one of the big ones, the first letter is A, is telling us the other day in the meeting, these problems are happening because we are too big. And my response was, well, you are not a utility company that you should be like, you are not like US Postal Office, you are not Amtrak or whatever the government owns, you are a private company. So what happens? They use that as an excuse. But then when you look at how big this company is, they are bigger than most of the countries. They would be in the top 50 if they were a country. So, but they don't pay. Or they're trying to take something that they paid 2 years ago, and then they don't care what may happen with the patients, like if they make corrections so late and how that's going to impact our patients with the patient balances and other stuff. They just don't care. So this is the only industry that you don't actually not getting paid is almost okay. Now, on top of that, we are introducing this late charge entry, which makes it even more difficult, because when you don't actually submit the claim, the 2 years or 3 years doesn't apply to us. So as you can see, like in some cases 3 months, some cases 6 months, and some cases 12 months. But when they need to take the money for corrections, it can be up to 3 years. So we live in this double standard. So that's why I thought this was important for our providers, our employees, our network to know what we do from the charge entry standpoint, how we keep track of it. And it's not just not entering the charge, but it's impacting the entire practice management, because you cannot use the practice tools in a manner that, in an efficient manner. So that's, from that point, this was a really good update. Thank you. And you did excellent. And I don't think you did tell people in the beginning, but when you were introducing yourself, but you are also an awesome tennis player. So people may not know that. So you did. I may have missed that. So But thank you for joining us, and I'm sure we'll have you back again in the near future.
Of course, yeah. Again, thank you for having me.
Yep, thanks. Orange, we are back to we do the global current events first.
Yeah, sure.
So
yeah, we have quite a bit of things that did happen recently on our global scale that we like to cover. First of which I'm sure most people have already heard, but Queen of England passing, and we just wanted to obviously touch on this as it's a significant event that happened across the globe. So
you and I, we always go through this with the how media actually is taking our attention. So I mean, who gives shit to the Queen of England? But she's everywhere. Like I don't know why she didn't die up until now. She's 99 years old, a miserable person. Why do we have like royal family? It's embarrassing. In year 2022, they believe they are better than other people. They cost a lot to their nation, and yet they are taking the spotlight away from everyone else. All the other problems that we have right now, currently, we do have a lot of issues all around the world, but everyone is worried about who's going to take care of Queen's dogs. So, and that's where we spend our time. And we open up with her. And I'm sure there will be, I mean, I did a lot of research. I did a lot of reading in the past with this family. Unfortunately, I know maybe a little bit too much. It's a joke, but reality is they are still there. Now it's a big deal. The person who's elected has to go and then kiss their hand and get their blessing. And we call that democracy. So that's the double standard we live in. So
yeah,
let's go to the next.
So we did touch on that. Also, just going down in the order of the slides we have here with Ukraine and the war in Russia. We know we've been covering that for months now, since that started the middle and end of February of this year. And we are now almost a year, we're approaching a few months.
Yep.
Yeah. And
so I think this winter, for especially European countries, if something doesn't happen before, it's going to be really tough. So they make a lot of preparation, heavy preparation for the worst. But it's going to be, we are going to all feel that if that happens. So like we have to find some solution to all these problems, hopefully soon.
Right.
Because I don't think we can, it's not going to be just Europe. So it's going to be all around the world. So it's already there. It's already affecting. But the cost is so high. We still don't know why we are going through this. It's unfortunate.
Yep.
Anything you want to add?
Yeah, and just as you mentioned, though, the impact is not, felt only in Europe, as we touched on sessions ago, how there was grain supply not being able to get to the countries in Africa, or then experiencing famine as a result of them not being able to reach terms. And finally, the port was opened where the Ukraine could ship out their grain. So there is this ripple effect that kind of may be overlooked initially, but like you're saying, something has to happen soon. That way, the sooner you get the resolution as we approach winter, you're not going to want to actually reach, we're at 7 months now. Once you get to a year and nothing's happened, you need some type of progress and get a successful resolution sooner.
Absolutely.
Yep.
So let me see what else we had.
Well, regarding this war too, we also had India and how they were one of the allies. India and China, we know, we're working closely on Russia's side regarding their sanctions, or lack of, I should say. And now it's kind of ironic, but the articles are coming out how India is now saying that they were not supporting him, and they saying it's not a time for war.
So they're one of the 5 members of the Shanghai Corporation, right? That's Shanghai 5. So I think this week there's a meeting there.
Yeah. So
I think Turkey president is also there as an observer, if I'm not mistaken. I just read this morning. But I mean, all these things are happening is fine. But like the problem is, the impact on the economy and how the energy is being utilized, who's actually controlling it, it's getting more problematic and more like regular people are going to be affected by this.
Mm-hmm. And it's also interesting to see like the ties, like you're saying, on who's using what energy, how, China with such a large population demand, how they're still buying from Russia. So it's not really impacting their economy as much, and how Russia's actually benefiting from their oil sales that they're still continuing during this, even though other Western countries may have put certain sanctions.
So sanctions are not going to work. So they really need to find out if you're solution oriented, this is the only way that's going to go. Mm-hmm. So if everyone goes there to take away from the other side, then that's not going to happen. But if you go there, the goal is to have a solution, then you have to give up something. So then there's nothing. Nothing was happening before. So like all this started because of some assumptions. So now it's out of control. And then if like this is happening right after pandemics, it's actually, it is making this more impactful in a bad way. So if we didn't have the pandemic before, maybe this wasn't going to get to this point.
Yeah, I don't think.
So one really important part, maybe like why we talk about these things, because this actually has an impact on everyone's economy, not just the countries, but our personal economies. So day-to-day, what we do, how we live our lives, what we pay for, utilities, gas, and other stuff. And what we also know is that certain economic policies do not actually work when you have something like pandemic, which took 2 years away from the world.
Yep.
Like that's a gap. So you cannot catch up that. Like we didn't have that much. Like you can just do overtime and then catch up that 2 years.
Right.
So people don't understand that. So you have to produce during that now to not to go back more than 2 years. The reason we have all these economic issues today and why the interest rate increases are not maybe helping, maybe we'll discuss that more on the US economy, is because the traditional norm is not going to be not effective. That's why other countries are trying different things, and the old-fashioned increasing interest is not going to be the right way to solve this problem. So I'm going to go to the U.S. economy from here.
Yeah, and kind of as we transition, just to touch on how you're saying some of these techniques have been attempted in the past, you can see that they don't produce, effective results.
Not at all.
So that's almost the definition of insanity. You're trying the same thing, hoping for a different outcome. And if you just look at the histories past, you'll see.
Sure. So like you can expect, I'm going to solve this crisis this way, like because I did it 20 years ago. It's not the same crisis. So I spent a lot of time discussing this with different people. Now, some countries are actually following different ways to overcome this problem. One is actually, I'll give an example from Turkey. So they actually do not increase the interest rates because they know that it's going to impact the production line. So if the production line is, if we have some gap or some, if we cut the production line or if we slow down the production line, then you're going to actually talk about a shortage of essential goods. Then it's going to be like you can deal with the inflation, but you cannot deal with not being able to find food or find gas or other essential elements in our life. So that's why many people, like if someone is teaching economics in college, they go with what they were told or last 100 years, like the supply and the demand, blah blah blah. Well, I went to those schools, so I have 2 MBAs. It doesn't work that way. So it's a different landscape, different. This time, the environment has a different DNA. It's not the one it was from 60 years ago or 100 years ago. So if they knew everything anyway, so they would be the richest people, but they still teach at the college. So they can help themselves. How are they going to help the country. So
Yeah.
we need to be open-minded and then understanding what really is happening, why we got to this point. So one of the slides that we have, we talk about how we are not actually investing, or we are not investing correctly, or we are not investing enough.
Yeah.
We are not saving enough, spending too much, right?
Yeah. So, the title there is 65% of Americans are doing the wrong thing. And for those people out there, maybe you've ever read, a starter book or self-help book on finance, and it kind of does go over some basics here. But one of the lessons is, if you look at stocks as any type of product, like if the market is going down, this is actually a time you do want to be investing, because think of the stocks on sale. So you're buying these assets at a cheaper price. But people, I guess, emotionally or just naturally feel uncomfortable buying it. If they see the number going down, they'll assume it's going to continue down. And on the reverse side, people love to buy when they're at all-time highs, which if you think about it, chances are it's not going to continue to go higher. It will eventually fall. So
one of the reasons that we are also worried about is one of the news that we shared on our on my Twitter account is maybe perhaps one of the biggest interest rate hike is coming, which already what we are saying that this already is not working.
Yeah.
So what you said earlier for the global crisis with the sanctions don't work. So it just makes things worse.
Mm-hmm. There's a Band-Aid effect.
And also you have to have a really good reason to do that. So then unless everyone is on board, which is never going to be the case. Yeah. Like last night we have our ACO meeting, and there were 80 people, and one person was struggling, and that person was having a crisis to get into Zoom. And if you look at the world from his point, so the world was going down, but there's 79 people logged in, including one person from his office, right? So, yeah. But this doesn't mean that he was wrong. This doesn't mean that he didn't have that problem. This doesn't mean that he cannot make enough damage if we don't control his anger, right?
Yeah.
So that's why it's important to understand situational awareness, what's happening, what needs to be given, what needs to be taken, which battles we need to take. And these old methodology of fixing economy making things worse than what it is. Unfortunately, although I would consider myself someone optimistic, with the last 12 months moves from the government is making me a little bit
difficult,
less optimistic.
Yeah. Difficult to be optimistic in this type of situation we're experiencing. I agree. Yeah.
So after we make your week a little bit more miserable with giving you no good updates, but actually that's not true, because we need to prep ourselves for what's coming. So the best way to fight with these types of crises is preparation. If you're not prepared, 100%. Then you are going to be sorry later. So everything that's showing, like, I think I mentioned this before. I'm going to mention one more time because I like saying "I told you so." So there was just last year this time, one of my friends who's in news actually was saying that U.S. economy was going to be the best in 2022. Blah blah blah, and I'm like, everything else is showing us different. Mm-hmm. And then I just saw something from him 2 weeks ago, and so. Pessimistic for 2023. We don't want to have those kind of emotional ups and downs. The reality is right there, clear. So let's get prepped for this, and then make sure that we don't make any outrageous moves, because everything that from our level is affecting the government, because they think that we are expecting certain things from them because we like this or that. No, we just want the peace, the right thing, and so that we can take care of our patients, right, at the end of the day. So every day we do case conferences, and if we have these problems on our shoulder, how are we going to help our patients? So that's why we want to make sure that we are able to communicate these with everyone. We have, I think 2 weeks from now, we have our Lieutenant Governor. Actually,
I think it's October earlier.
7th, so she's coming right on October 7th.
Yep, so she'll be joining
but we
us.
have other events in between.
In the meantime,
and then we are trying to get our Congresswoman in November, and Jack Markell in December, hopefully, and our governor for January, for this beginning of the year.
Yeah.
We have our Bariatric Friday coming up. That should be in the next 8 minutes. Dr. Erkan is going to join me. Sean, I know after a break, getting back to what we do it takes a little bit of time,
Right.
but I think we did okay. So we have a new member join us. She's going to help us with some of our content. We are going to get some extra help, so hopefully we'll do better updates in the near future. Well, thank you for joining us, and we'll see you next week. Thank you again.
All righty.